Hello. At Kettering General Hospital, lots of new things are going to happen this year in relation to mouth care in the organisation. We'll discuss some of these things at the end of the video. However, in order to get you reinvigorated regarding mouth care, we've decided to have an introduction session on Training Tuesday. Mouth Care Matters is a Health Education England training initiative aimed at improving oral care or mouth care of patients in hospital. Let's just think for a moment, how many patients have you met that unfortunately have not had access or been supported to clean their teeth, mouth or dentures? Poor mouth care or oral health for patients in hospital can result in hospital-acquired infections such as pneumonia, as well as poor nutrition due to the ability of the patients to eat well. There are also links to cardiovascular disease and diabetes. This in turn will lead to an increased length of stay, poor quality of life and dignity for our patients. In order to explore this further, let's try and put you in the patient's shoes. How would you feel if you went away for a few nights and forgot your toothbrush and was unable to buy one? Many patients come into hospital in a hurry and forget to bring the fundamentals with them. How would you feel if you were on a busy shift with no time to stop and have a drink? Many patients, even though they may be given fluids, take medication that can make their mouth feel more drier than normal. How would you feel if you had a mouthful of ulcers? They are painful and affect our ability to eat. How would you feel if you had to talk or kiss someone with bad breath? In all these instances, it would have an impact on how you felt about yourself, your self-esteem. It would impact on your dignity. Your mouth would feel dry, your teeth may feel furry or unclean. It may impact on how food tastes and your ability to eat. When many of us are ill, we may not feel well enough to have a wash, but we would clean our teeth. Personal care and mouth care. We all ensure that either ourselves or people we care about have a wash, clean their teeth, brush their hair and wear clean clothes every day. And it's important that these principles continue for the patients that we care for. We do acknowledge, however, that mouth care is a hands-on skill which may feel difficult to deliver for a variety of reasons. You may feel that you're too busy, you don't have enough time. You may be unsure of how to clean somebody's teeth correctly. You may be worried that you don't want to hurt the patient. Should you use mouthwash? How much toothpaste you use on the brush? You may also feel that you don't have the right equipment to undertake mouth care. You may be worried about how to report concerns. Patients may say they feel too unwell, or you may have patients with behaviour that challenge and they may be resistant to have mouth care undertaken. It's important that we do endeavour to try and give people mouth care as part of personal care that we give every day. And in order to give you a little bit of confidence, the next video will show you from Health Education England, Skills for Health, how to brush somebody's teeth.
In this video, we'll show you the best way not only to brush your own teeth, but also how to easily brush the teeth of others. Toothbrushing should be carried out twice a day, in the morning and last thing at night. We must remember that not everyone can brush their own teeth. But when brushing other people's teeth, the principles are the same. Please remember that toothbrushing takes a full 2 minutes. Yes, 2 minutes. Use a small-headed, medium-texture bristles toothbrush with a small amount of fluoride toothpaste. Start by tilting the toothbrush against your teeth so the bristles are at a 45-degree angle to the gum line. Move the brush in small circular movements, a few times on each tooth. Next, brush the outer surfaces of each tooth, keeping the bristles angled against the gum line. Do the same thing for the inside surfaces of all the teeth. Now, brush the biting surfaces of the teeth, on the top and the bottom. To clean the inside surface of the front teeth, tilt the brush vertically for the upper teeth. Gently move the brush long ways down the tooth from the gum for a few seconds. For the lower teeth, tilt the brush vertically and pull the toothbrush gently upwards from the gum for a few seconds. If plaque is not removed from the teeth, it leads to bleeding gums and tooth loss. If you eat or drink sweet things, plaque mixes with the sugar and causes tooth decay. Finally, spit out any remaining toothpaste. Do not rinse the mouth with water or any kind of mouthwash. In this way, the fluoride in the toothpaste will help protect the teeth.
Thank you for watching that. We're currently finishing our updated version of the mouth care policy. We will be launching a new mouth care assessment, and this is currently being trialled on a few wards across the hospital. We're also going to be looking at what training we can offer for staff to develop their mouth care skills for all patients, including patients that are at end of life or those with additional needs. We'll also be sharing with you what equipment is available in the hospital and how best to use this. As I said earlier, this is the course that is available to you on ESR. It's called Improving Mouth Care. If you have any difficulties in accessing this course or logging on, please contact Staff Development. And finally, thank you for watching this video. As you can see, mouth care matters to everybody. It's really important for our patients in order that they are prevented from having any additional hospital-acquired infections, that their length of stay is reduced, and that their dignity is upheld. Thank you.